Welcome to Mind Body Reset Gym. Glad you're here for your workout. Today's topic is what I wish I'd known before I had bariatric surgery. Although our surgeons do a great job educating us ahead of time on the physical changes and sometimes the emotional changes, this one is a deeper dive on some things that you don't always hear about and that are really important to think about. The first one is that weight loss surgery is not a magic wand. And we hear over and over again, weight loss surgery is just a tool, and you use the tool, and it's a great tool to have in the toolbox. The mental end of our weight loss and the body dysmorphia and the food addiction and the dysfunctional food habits don't go away with surgery. It's important that we create new ways of thinking and new habits of planning to go along with our new body for it to be successful. The second one is our moods sometimes can get actually more anxious or depressed after surgery. This study that I refer to here shows that 13% of the population increased in depression 6 to 12 months after surgery. And some possible reasons for this: when we use food as a nurturing or coping mechanism, we take that away and we're faced with our feelings, and that can cause anxiety or cause depression. It also feels like a loss when we don't eat anymore. Sometimes food has been a real friend to us, and so to say goodbye to that friend can be particularly hard and sad. Another reason is that there's a lot of anxiety and fear around losing weight. Maybe I'm not going to lose enough. Maybe I'm not going to be able to keep it off. And so in that first year, as things are getting back to whatever the new normal is, there's a lot of questions and a lot of fear. So I've listed some other options to food, and you can come up with your own as well. But mindfulness and meditation are two that work really well. They're different for us usually because it forces us to just sit quietly and ponder and contemplate, and not for a long time, 2 to 3 minutes to start with, and just breathe and just try to quiet our thoughts and our fears and see what's really going on inside. Another thing you can do is yoga or Tai Chi or any other breathing-based exercises. They work really well to help calm things down, help us get in touch with our bodies. Another one is journaling, talking to friends or other bariatric patients, and I might emphasize those patients need to be on a good path, on a good journey, and be healthy within the program in order to give you the best counsel and support that you can receive. And then reading about others' experiences, again, making sure that these are healthy people and that their experiences are useful to you. Another thing that's true is that surgery doesn't make you quit thinking about food if you already thought about food before surgery. I don't know how many surprise clients I've had. They thought surgery would take care of that issue, and it doesn't. Right after surgery, sometimes you don't want to think about food because it just sounds really gross. But when you start enjoying food again, thinking about food comes back. And we have to work every day for it, especially to develop the new habit of a food plan, daily movement, exercise, walking, whatever that looks like for you. And just be in the mindset of this is a change, this is part of the change. It's not just the surgery. The surgery was a tool, and that's it. Also know that weight loss causes our metabolisms to change. And as we lose more weight, we plateau more often, and we stay at the plateau longer. And it's tempting to get discouraged or to worry that we haven't lost as much weight as we thought before we are done losing weight. It's important to just stick to your plan. Just calm down, meditate, be mindful, and breathe, and see what your body can do. Do not go back to the plan and the old way of eating your way through it, because that won't work. If you stay focused on the plan and you plan on doing the work, you'll reach and retain your goals. Another one is that it changes your relationships for better or worse, and we have another video devoted just to this topic because it's very important. But think about that drastic physical transformation that you're going through. It not only changes you, but it changes the way people look at you, the way people treat you, and it takes a little while for them to get used to the new you as well. There's been an uptick in divorce rates among couples that first year after bariatric surgery, and it's important to know that you have to redefine what your relationship looks like. You might be more functional, you might want to be more independent, you might do more things for yourself, and the people that have been helping you might get really puzzled by that. So it's important to communicate. Go to counseling if that's helpful. Ask your partner to come to your counseling and communicate with them about the relationship that you want. Join a support group and ask your partner to join a support group too, if that's helpful. You're going to poop a lot more, and it really happens a lot, of course, the first 10 days out of surgery, but then it continues on and off depending on things like what you eat and how often you eat. If you have too many processed foods or sugars, then you get something known as dumping syndrome, which everybody usually gets at least once. And that is pretty unpleasant. And it could be mildly unpleasant or it could be severely unpleasant. Besides pooping, besides diarrhea, there's symptoms like sweating, flushing, lightheadedness, need to lie down, nausea, cramping. You can hear your bowels rumble from across the room. The farts are smellier and grosser. Those are just some lovely things. And that usually we're warned about ahead of the surgery. But it can last for years. So don't think you're out of the woods after the first year or two, because it can keep going. And then the other one is that it could boost your risk for alcohol abuse. One study looked at people who'd had gastric bypass, and they looked at them at 3, 6, and 24 months after surgery, found that there was an increased alcohol use after the procedure, and it was a significantly higher increase in risk. So it's super important that you be careful of your alcohol use. They're thinking that it might be that bariatric patients reach a higher peak alcohol level more quickly, but it could also be across addiction, moving from food to alcohol. So be aware that you're high risk for that. So for your workout today, it's good to reflect on this either ahead of time or wondering, where am I in this whole process? So what, if any, of these weight loss surgery outcomes have you experienced or are at risk for having now or in the future? For example, were you using a lot of alcohol prior to surgery? If so, then you might be at risk for going back to that, even though you don't want to or don't intend to. And then if you notice one of these outcomes, what's your plan? What are you going to do to make it through that? Make sure that you don't dump, that you don't get re-addicted or drunk too quickly or whatever. Having a plan. If you go into the store, how are you going to make sure that you come out of it in one piece and not with all kinds of things that you didn't intend to buy because you think about food? So having a plan, and then again, working your plan, following your plan. And after a while, believe it or not, it becomes a habit. And it's still not a walk in the park, but it's not hard. It's not as hard as it is when you're first starting out. So that's important to know too. So write those down. And then notice every day, how strongly do I believe that I can be successful? How motivated am I to be successful? Make sure those are between a 6 and a 10. If they're not, please work on them. What are my resources? And keep adding to those. Knowledge is a resource. Journaling is a resource. Talking to other people is a resource. What are my challenges? What's hard for me today? And so keep track of those. That will really help in your journey. Good luck, and we will catch you at the next gym. Have a good one.